To diagnose PCOS, you need 2 out of 3 criteria. 1 is irregular period. You have 2 is PCOS looking ovaries on ultrasound, which your mom said you had an ultrasound and they told you have a string of pearl. So that's number 2. So based on those 2, you're diagnosed. And number 3 is elevated testosterone symptoms. So it could be, most common is facial hair, body hair. You could have hair loss, acne, body acne, facial acne. So we know you have 3 out of 3. So there's no question about the diagnosis. PCOS patients usually have mood disorder. It's hard to say if mood disorder is part of PCOS or because of the weight gain and the acne and the hair loss and, they get frustrated and, it eventually affects their self-esteem and their mood and all of that. So it's hard to differentiate that for patients, but they usually have family history of an overweight family member or, someone who's diabetic or pre-diabetic. And they tend to gain weight as they get older and it's harder for them to lose it. And, generally speaking, they have a lot of eggs on blood tests, but the quality of it goes down after 30. So I would tell you, if you were my patient and you can afford it by 30, I would have you freeze eggs, even though you're going to have tons of it. Have you done an egg count? So that would be something.
But we've been talking about her eggs, and she said the other day, wonder if I should freeze them.
How old are you?
26.
So it's a little too early. I mean, you can freeze eggs at any age, but it all depends on your egg count, right? Because so many factors affect your egg count. PCOS patients, generally speaking, they will get a higher number of AMH in their blood count, the anti-Müllerian hormone that gets released from the follicles, but the quality of it goes down after 30. So because of that, unless you're ready to have a baby, I would say freeze eggs maybe by 28, but you need to check your hormones. You need to check your egg count. Even though we don't need high testosterone in the blood to get the diagnosis, you still need to know what your egg count is and what your hormones are.